your rehab expert.
There are other controversies with kinesiology tape that I'd like to address with some of the research. And the first is tension. Does tension really matter with kinesiology tape? Well, I would say yes, and Lim and Tay in their meta-analysis agree that tension is important. And what they found actually was that studies that had higher tensions were associated with lower effect sizes. So what that means is that probably lower amounts of tension are important when we're applying our kinesiology tape, more so than no tension. So when we talk about the Thera-Band kinesiology tape, most of our applications are going to be less than 25% or somewhere between 25 and 50%. We've actually done an internal study on the tension that's produced with Thera-Band kinesiology tape. And what we showed was that as you stretch the tape past 50% tension, you're going to see a significant exponential increase in the force that's produced by the tape. So what you're seeing after a 50% stretch is actually a bit of recoil within the tape. So when you apply tape on top of the skin at over 50%, you're at risk for skin irritation, because what we believe is happening is that you're actually contracting the tape back on itself and creating more tension, which may create more irritation to the skin. When we did a review of the literature of kinesiology tape and actually extracted all of the tensions within kinesiology tape research, we found that outcomes related to muscle and joint support generally had less than 50% tension. So if you look at the outcomes related to muscle support, such as muscle activation or muscle strength, and we look at the joint support applications, which may include things like range of motion and flexibility, the studies with significant positive outcomes generally had less than 50% tension. When we look at outcomes related to proprioception or circulation, those outcomes tended to be less than 25%. So when we look at the overall recommendations for application, your muscle and joint applications are going to be basically less than 50%, and your neurological and your circulatory applications are going to be less than 25%. There's one case generally where you may use over 50%, and that's where we want to restrict motion with a joint support application. So if I actually want to reduce the amount of motion in a joint segment, I may apply more than 50%, but I'm also going to make sure that I'm looking for skin irritation and those issues which may be associated with more than 50% tension. In general, the only conclusion we can make about the outcomes that are supported with kinesiology tape are a reduction in musculoskeletal pain, which is consistent with minimal interventions to reduce pain, and there's very little evidence to support if kinesiology tape actually can decrease swelling. There is some evidence about reduced swelling in lymphedema, but the evidence is not conclusive when it comes to acute swelling like in ankle sprains. We also don't have a lot of support for proprioceptive improvements after wearing kinesiology tape. So we're not seeing those improvements, or when you hear someone say it's a proprioceptive effect, that's probably not true when it comes to kinesiology tape. And in terms of increasing or decreasing muscle tension, that is not happening with kinesiology tape. There are several studies that have shown that the direction or the tension don't really matter when it comes to thinking that you're turning a muscle on or turning it off. So if you're applying it in one direction or another direction, it really doesn't matter. What really matters is having the tape applied and staying on the skin so that it's having that effect on the skin to increase that input, which we think may be associated with that gait control theory overriding pain signals.